So friends, let's just talk about the diagnosis of Pseudomonas aeruginosa. Since if a patient is suffering from a Pseudomonas aeruginosa, so our first diagnosis will be the crown staining, whether this is the most initial diagnosis step. Then we'll refer patient for the culture. That will be with a very special medium, that is the McConney agar. Then we'll further refer for CBC, urine analysis. Why urine analysis? Just because a person we know is suffering from urinary tract infection. So then after that CSF. If a patient is susceptible for meningitis, then we'll refer for the CSF test. That will be through lumbar puncture, that is the cerebrospinal fluid test. Then apart from this, if we know the patient has some like symptoms for pneumonia, then we'll refer for the sputum test. The treatment will be related with the anti-pseudomonal penicillin. That is the most important treatment for the Pseudomonas aeruginosa. That is the anti-pseudomonal penicillin are widely available in the markets. Aminoglycosides. Then we can give the combination of amikacin, ticarcillin, and such others. Well then, if a patient is suffering from meningitis, then we can refer ceftazidime. Then apart from that, what we can do for the prevention? Prevention will be pasteurization. As we know, the disease is caused by water droplets. Then we'll take care about the disinfection of water, related equipments, hand washing, then the removal and the safe removal of catheter, and the various care of the catheterized patients. So the Pseudomonas, we are over with the Pseudomonas. As we know, it is the gram, what? Okay, just think about it, no. Okay, this is oxidase positive, Arabacteria, lactose ferments. Then the most important is the infections. Yes, the infections are bone and joint infection, bacteremia, pneumonia, UTI, septic shock, and the skin and tissue infection, and it is the number one cause of nosocomial pneumonia. Okay, so what we have to understand, this is the number one cause of nosocomial pneumonia, and also it is further infected through surgical wounds, bloodstream infection, as I told you, bacteremia. In immunocompromised patients like burns, cancer, and AIDS are the high risk patients, high risk groups. Then the diagnosis, we'll go through the diagnosis. Diagnosis will be ground staining, culture, CBC, urine analysis, CSF if meningitis, sputum if pneumonia, and the treatment is anti-pseudomonal penicillin. Anti-pseudomonal penicillin, that is the most important. Anti-pseudomonal penicillin with a combination of aminoglycosides. So like amikacin, ticarcillin, piperacillin. So there are several group of penicillins, and the ceftazidime will be for meningitis. Okay, and the prevention, as I told you, pasteurization of water and disinfections of water related equipments, and especially in hospitals as well, and then hand washing, and the removal and the care of the patient, of the catheterized patient. It is the most important thing. As we know, the catheterized patient who have a history of catheterization will have urinary tract infection. So we are done with the Pseudomonas aeruginosa. Let's just talk. Then we'll go in the next part. We are going to talk about Legionella, then pneumophilia. Okay, over there we'll talk about the Legionnaires diseases, transmission, pathogenesis, and treatment, diagnose and all this related stuff.